All right, you're sick of not pooping, and today I'm hoping you find the answers that you're looking for. Whether you've been constipated for 3 decades or constipated for just a week, we are going to run through all of the possible scenarios of why you might be constipated. First, we're going to talk about an at-home test where you can see how fast things are moving through you. So are you constipated or are you not? Then I have a checklist for you of 5 things to just check off your list before you dive into a deeper root cause. Make sure that you are checking off all of the things on the checklist and you're still constipated. That is your sign that you need to dig into something deeper. And then finally, we'll talk about the root causes, and I have a resource that you will find extremely helpful. First, let's talk about how to tell if you're constipated. So the first thing is to turn around and look in the toilet bowl and see what your stool looks like. So if you have hard balls or maybe they're stuck together, maybe it is hard to pass. Maybe you pass just a little bit of stool and you always feel like there's something left. That's something we call incomplete evacuation, and it is a form of constipation. If it's really hard for you to push things out, that's also constipation. But you might be somebody who tells me, Brittany, I go every single day, but I just feel like there are things backed up. That can be constipation as well. So what you can do is an at-home transit test. Eat 1/2 cup of corn. Don't chew particularly well. I mean, chew your normal amount, but don't chew it into oblivion. And then you want to wait and see how long it takes to start seeing the corn in the toilet bowl. So you want to time when you first start to see it and also when you stop seeing it. So the goal, the ideal transit time, or ideally how quickly things are moving through your GI tract, would be starting to see it at 12 to 24 hours. So that's when you first see the corn. And then it is completely done by 36 hours. So you're not seeing it anymore. If you fall into that category, you're doing pretty good. It doesn't mean that you don't have some degree of constipation, but at least things are moving through at an appropriate time. Let's talk about a checklist of things to make sure that you're doing before you take a deeper dive into a root cause approach, or before you invest in me and my team. Let's make sure that these things are checked off your list. Number 1, I know you're sick of hearing it, but I have to mention it. Are you dehydrated? So the body starts to feel signs of dehydration at less than 8 cups of fluid per day. You can count all of your fluid. I know there's debate on, can I include fluid if it has caffeine because then you pee a lot more? Yes, you can count it. So 8 cups of fluid. That can be tea. Hopefully you're not doing a bunch of soda, but of course that can count. Water, electrolytes, all of that counts. 8 cups minimum. Make sure that you're there. Second would be, are you moving your body? Are you getting at least 7,500 steps per day, in addition to any exercise that you're doing, any organized exercise? Ideally, you're at 7,500 steps baseline, and then you're adding some movement on top. Maybe it's weight training, maybe it's yoga, maybe it's going on a run, whatever that might be. Movement helps kind of push things down. It helps stretch receptors recognize that there's stool that needs to be expelled. So make sure that you're checking that off your list. Next would be fiber. Again, I know you're sick of hearing it, but you would be shocked at how many people come to me and they say, Brittany, I've tried literally everything to fix my constipation and nothing works. And I'm like, are you drinking water? No. Are you moving your body? No. Have you tried fiber? No. So that's great. And I would love to help you through that. But it might behoove you to just check some of these things off first. So the goal would be around 30 grams of fiber per day coming from whole food sources. Can you supplement with fiber? Yes. But ideally it is coming from whole foods. I actually have a free fiber guide. If you just want a really easy resource where it lists all of the foods and the amount of fiber, you can grab that and I'll link it below. All right, so fluid, movement, fiber. Are you eating enough? Period. Are you under eating? This is a huge thing I see because we work with females in my practice. Big problem that I see is generally under eating, which is so common when you have gut issues because you feel miserable when you eat. You're afraid to eat. And so that leads to just massive restriction in terms of calories. But if you are not eating enough, all of your systems are going to slow, and that includes the GI tract. So you may consider, is there a way that I can slowly increase my intake to see if that helps clear things out? All right, that's number 4. And then the 5th is medications. So are you taking anything that is causing the constipation? Now, usually you'll know this. You'll say, I was totally fine, and then I started taking that medication, and then I started to kind of back up. In that scenario, you may ask, is there an alternative to this medication? Is there a different type that maybe I can tolerate better? Perhaps it won't cause me to back up stool, or it might be a scenario where that's the only thing that has worked for you. So an antidepressant, for example, one of the big ones that can cause constipation. Now, my recommendation is not that you go off of your depression medication, but again, maybe finding an alternative. If you cannot go off of that specific medication, so medications that we see that cause slowing are opioids, thinking iron, antidepressants. There's actually a lot more. Birth control can add to it as well. But if there is no way that you're going off of that medication, then you need to talk to somebody about a Band-Aid approach to make sure that you're still clearing things out so that you don't set yourself up for further gut dysfunction down the line. Because this is also something I see where clients have been constipated for a decade or two, and it was just constipation. But now, because it's been going on for so long, it's actually now turned into extreme bloating and food sensitivities, and now it's constipation, but sometimes diarrhea. So the longer that you go with constipation, the more you're setting yourself up for further dysfunction down the line, which is a much bigger cleanup from a practitioner standpoint. So if we can get a hold of this constipation in the first place and fix it, then you don't have to worry about those downstream side effects that are arguably much worse than the constipation itself. So those are the big checklist items. Make sure you are drinking fluid, moving your body, eating fiber, eating enough, and then medications. If you want to look at some faster approaches just to give you some relief so you can collect your thoughts in long-term healing, I put together a constipation toolkit for you. It is 26 pages of pure gold in terms of how do we nail all of the checklist items and make sure that it's easy and doable for me. What are some tips and some tricks and food lists and recipes, things that are going to help reach your fiber goal, things that are going to help in the movement front. This toolkit is not going to address your deepest root cause. It is a way to find you relief fast so that you can get out of crisis mode, so you can think about the next steps to actual root cause healing. I always said I would never put together a Band-Aid approach because I am not about Band-Aid approaches. I am not about fixing the symptom. I'm about addressing the root cause. But I saw over and over again how clients could not get out of this crisis mode. They couldn't even think straight because they were so completely miserable. So I thought, okay, I need to help you get out of crisis mode. We need to get you out of that zone where you feel like you can't focus on anything else. We need to clear your bowels so you feel clear-headed and ready to tackle the next steps, which again, maybe it's working with me and my team on the actual root cause of your constipation, which we're going to talk about in just a minute. But you can't get there if you don't have the mental capacity. So the toolkit is really like a launch point for you feeling better so that you can tackle the bigger things. If you are interested, I will have the toolkit linked below. And I don't know why I have not upped the price. I've kept it discounted for months just because honestly, it's been at the bottom of my to-do list. But the price will be going up. Currently, it is still $49, which is literally 75% off of what I plan to sell it for. So make sure you grab that below. And now let's talk about root causes. So I have 5 listed here. Generally, my clients fall into these 5 buckets. And then again, there's an honorable mention at the end of extra things that you might consider that might be causing the constipation. So root cause number 1. General dysbiosis of the gut. So dysbiosis is essentially an imbalance of good and bad bacteria. This could mean that you have not enough good bacteria. It could mean an overgrowth of harmful bacteria in general. The reason this can lead to constipation is because the good bacteria are keeping the entire gut environment healthy. They're feeding the cells of the colon. They are supporting the immunity in your gut. They are supporting the mucus layer of your gut. Your gut needs to be in tip-top shape to be pooping every day. So when you don't have those good bacteria that are supporting the overall gut environment, things aren't going to go well. An increase of bad bacteria damages the entire cell the entire microbiome environment as well, which then can lead to things slowing down. If you're experiencing that dysbiosis or that imbalance, it's also very possible that you see some cycling loose stools in there. You might also see some food sensitivities too, in addition to the constipation. The second root cause is something called intestinal methanogen overgrowth. So methanogens are actually not bacteria. I won't get too nerdy about that, but there's a reason that it's separated from the first root cause. So methanogens are this tricky little bug that can cause constipation itself. So the methane gas that is produced by these little bugs slow motility on their own. The problem is that constipation increases methanogens in the gut, but methanogens also cause constipation. So clients can get into this loop of I'm constipated, but now they're overgrowing methanogens, which is furthering the constipation, which is further increasing the methanogens. And we have to just interrupt the cycle. We have to get in there somehow and start changing the terrain of the gut. So generally what we see with this is pretty extreme bloating as well. The methanogen overgrowth can be in the small intestine, or it can be in the colon, or it can be in both. Both scenarios, you're going to see constipation. If you have an overgrowth in the small intestine, you're also going to see really pretty extreme bloating. A lot of food sensitivities specifically to those high FODMAP foods. So if you went on a low FODMAP diet and you're like, man, I feel amazing, it's very possible that you have a methanogen overgrowth in the small intestine. Here's the bad news. A methanogen overgrowth in the small intestine comes back cyclically if you don't have a practitioner that addresses it in the correct way. It is not something that will go away on its own. A methanogen overgrowth in the colon, in the small intestine, is not something that just clean eating will fix. It's not something that working out will fix, or drinking water, or eating fiber. In fact, the eating fiber part might actually make symptoms worse. So if you're going through those checklist items and you're like, Brittany, I can't eat enough fiber, I can't get 30 grams of fiber a day because I feel miserable, that is a really good sign that it's possible you have that methanogen overgrowth. So working with a practitioner to not only clear the methanogens, but to also make sure that you're changing the entire environment of the gut microbiome to make sure that the methanogens aren't allowed to overgrow again. The recurrence rate of an intestinal methanogen overgrowth is insanely high. Again, if you're working with a practitioner who doesn't understand how to keep it gone forever. All right, the third cause of constipation that I see is actually anatomical. So these are the clients who say, I've been constipated from the second I came out of the womb. Right? My mom said I was constipated as a baby. I had to take Miralax as a kid. It's always been an issue. And if you feel like you've been through provider after provider and nothing gets it to budge, you are just so insanely slow in terms of motility. Very possible that anatomically you have something called a long tortuous colon or a redundant colon. This is a colon that is extra long, and colons can be up to 3 feet longer than average, which is insane. It's actually insane. A colon is meant to go up and over and down. So you can imagine if you have 3 extra feet, it's going to have to go up and like turn and twist, and then it kind of goes over, but then it's got to turn and twist again. It's just a longer journey, but the twists and the turns make it really problematic as well. I cannot change if you have a long tortuous colon. That's something that obviously I can't do anything about. If you've had a colonoscopy, this would be noted on that colonoscopy. If you've had a colonoscopy and it was not noted, then this probably isn't a root cause for you, but it can be really problematic because you have to stay ahead of it. There are still lifestyle things. If you're experiencing not only constipation, but food sensitivities and bloating and all of these things with it as well, it's probably turned into a deeper issue. So again, what started with just constipation has now turned into something much deeper that requires a practitioner to come in and start cleaning up what was caused by the constipation in the first place, right? So if you are looking at your colonoscopy or you're like, oh my gosh, yes, my doctor told me that's exactly what I have, cool. I still think it's a good idea to work with a practitioner to make sure that we find a method for you where you're actually clearing stool completely every single day to prevent further issues down the line. Again, it's one of those things, it's an easier fix in the beginning if you can get ahead of it versus trying to play cleanup afterwards. Okay, so that was the third anatomical. The fourth is post-infectious dysmotility. So this is if you've ever had food poisoning, or you had a really terrible stomach bug, or you went to an all-inclusive resort, you pooped your brains out, and everything started to slow after that. You can have something called post-infectious IBS or dysmotility. What's happening here is there is a lot of damage that, let's say food poisoning, for example, that the type of bug that causes food poisoning, it honestly wreaks havoc on the entire digestive tract. And it is so problematic that it changes everything. Like yesterday, you were a normal functioning person pooping just fine. And the day after that happens, everything is messed up. And that was my story. I had food poisoning terribly. Note not to get seafood in Missouri in the middle of the country where we are not even close to an ocean. But it happened, right? Terrible food poisoning. Never had gut issues before that. And then literally the day after developed debilitating constipation, bloating, food sensitivities, anxiety, depression, so many more symptoms, back pain, irritability. Like it was the worst little segment of my life. And I think it made me a better practitioner because I really understand. When I say I get it, I mean 100% I get it. I understand what it's like to feel like your body is a runaway train. I get it. And I also understand how to fix it because not only have I lived it, but I am literally certified in this. I have a master's degree in functional health. I'm a huge nerd and have over a decade of experience helping you reverse your IBS-like symptoms. So it's kind of a cool combination that I have the educational background, but then also the experience, which by the way happened after I was already working with gut health. So I think like I really lucked out. Like I picked the perfect profession for what happened to me. Okay, anyway, I digress. So back to the post-infectious dysmotility. Part of the damage here, again, is in the bugs themselves. They create issues with the way that your nerves signal. They create issues with the electrical impulses that move things through. There's a lot of damage, and unfortunately, this is something that takes quite a long time, a much longer time to resolve than, say, a methanogen overgrowth or dysbiosis. This is one of those long haul of let's get everything cleaned up and feeling really good. And we kind of send you on your way, but it might be 6 months or more before you really start turning the corner of 100% symptom resolution. It just takes a long time because of the level and the degree of damage that was done from those food poisoning bugs or stomach virus bugs. All right, the fifth root cause here is hormones. And this could be hormones in terms of right before you start your period. It is very common to be a little bit more constipated and backed up leading up to your period. It is a degree of normal. With my clients, we work on strategies to add some Band-Aid approaches to make sure that they're still emptying every day. But we also see changes in perimenopause. So when progesterone and estrogen are in flux and one's lower and one's higher, it really creates a problem with motility. So if you are in that kind of perimenopause age, one of the best things you can do for your gut is to make sure your hormones are as balanced as they can be. So that's the sex hormone side of things. But we also have to talk about the stress hormone side of things. Cortisol. So cortisol is your stress hormone. And when it is high, it does a couple things. So for some people, it actually speeds motility. That's like when you're preparing for a big meeting or a speaking engagement and you have to run to the bathroom, that's actually cortisol at work. But for other people, cortisol really slows things down. So stress increases that cortisol hormone, and then cortisol really slows things down, which results in constipation. So what do we do for that? Obviously, again, if you're perimenopausal, you want to get those hormones in check. If it's just right before your period, that's the time when you bring in those Band-Aid approaches, and that constipation toolkit for $49 that I mentioned earlier has those Band-Aid approaches. Those are the things that you want to take just the days leading up to your period, just to make sure that you're fully emptying and feeling your best. In terms of cortisol and stress, I can't tell you exactly like this is what you need to take. I don't really love adaptogens, so those like stress supplements that people take, I don't really find them to be effective or compelling in any way for clients, but it's more about looking at your life and looking at where can I set boundaries? Where can I start saying no? How can I carve out a little piece of relaxation for myself every single day? And yes, you can do it even as a mom. I am a mom of two young girls, and I have always made it a priority to find some time for me daily. And it's different. The newborn stage is different than the toddler phase, is different than the older kid stage. But there is always a way to do that, or asking for help. That's a big thing that I see with my clients. And they are, they're the mom, they're the wife, they're taking on 90% of the household duties. And they're also working outside of the home too. And they're not asking for help because they say, well, he should just offer to help. Well, that's not really how their brains work, to be totally honest. You need to advocate for yourself and say, I feel like I'm overwhelmed. I cannot do this. Is there any way you can take any of this off my plate? And usually they're more than happy to. So, sometimes when we have this conversation about constipation, it's actually a discussion about how you communicate with your spouse. But it's just, again, illustrating that constipation is so much deeper than fiber and fluid. It's a whole body approach. And that's exactly what we do for our one-on-one clients. We look at, okay, these are all of the possible causes of constipation, but what is your cause of constipation? And we can streamline that process for you, because you might be listening to this, and we're not done yet, but you might be listening to this and thinking, I don't know, I kind of feel like I'm that one, but I also feel like I'm this one. We take the guesswork out. And that is the beauty of working with a practitioner, which again, I will link below to our services and how to work with us. Or if you just want to learn more or hear from our clients what it's like to work with us, I think that's important. Fit is really important for me, for our clients. And so if you're listening to this and you're like, oh, I love everything you're saying, I love your approach, let's talk about what it looks like to work together. So I'll link that below. Okay. And then, so those are the 5 root causes, but then here are like the honorable mentions. Okay. If you have been taking a stimulant laxative or enemas, or you've been doing colonics for a long time, you have likely created a dependency to those things, which now we have to overcome. That is also a long haul to pull off of those things that might be your lifeline. That might be the only way that you are going. The problem is that you're worsening the deeper issue for immediate relief. So we have clients that come to us, again, who have been on these stimulant laxatives or enemas that are really prompting a bowel movement. What we have to do is get you on a different Band-Aid approach to wean off of the thing that's causing dependency, fix the underlying issue of the constipation, and then slowly wean you off of those other Band-Aids. That is literally the only way through. So that's really somewhat complicated, but again, requires a practitioner to come in and give you an approach that's going to work for you so you can wean off of those. It's that hard place to be of like, I don't want to be constipated, so I have to take this, but I know that that's creating dependency, so I can't ever live without it. So now what do I do? It's a really sticky situation, and one, again, that we're happy to help you navigate. So that's the first honorable mention. Second one here, Hashimoto's. Hashimoto's slows motility. It doesn't mean that you can't have a complete daily bowel movement with Hashimoto's or hypothyroidism. It just means that we might need a little bit of a more nuanced approach when it comes to nutrition or lifestyle. We might need to hit those points a little bit harder. The second is diabetes. Even if you have well-controlled diabetes, you can develop a degree of gastroparesis, which is the slowing or stopping of movement through the GI tract. Again, something we just have to take a little bit more of a nuanced approach with to resolve the constipation. And then the final one here, GLP-1s. I am not anti-GLP-1s. However, the mechanism of action, the way that GLP-1s work, is by slowing motility. That is what it's doing. That's how it works. It's how it decreases hunger because it keeps food in your stomach for longer. It slows the motility of the small intestine, and that can predispose you to constipation. Again, I don't want you to trade a problem for another. So maybe you're taking the GLP-1 because you want to lose weight. Cool. But now you've created constipation, and the constipation needs to be dealt with, because if it lingers for years or sometimes even months in clients, it can turn into some of these deeper issues that we talked about before, which again becomes a much more complex thing to solve. So I'm not anti GLP-1, but I want you to understand that it does predispose you to constipation, and you definitely want to get ahead of it if you're taking it and noticing some slowing. I think we got through everything. Don't forget, you can grab that free fiber guide if you just want help nailing those fiber goals. I have the Constipation Toolkit for $49. It's a great starting point to make sure that you're addressing the constipation in general and feeling more functional so you have the capacity to focus on root cause healing. If you are ready to dive in and like completely put this behind you, you're done with the constipation, you're done with the bloating, you're done with the food sensitivities, I would love to have a conversation with you. The way that that works is you can go to my website, which will be linked below. You can read through our program details. I have pricing, everything totally transparent on the website about what's included. If it sounds like something you're still interested in, you will apply to work with me and my team. Then if I feel like we're a good fit, you'll set up a 30-minute video call with me. No strings attached. It is free to see if we are a good fit for you. I'm very much about fit. If I don't think we can help you, I will straight up tell you I don't think we can help. But if I feel like I'm so positive we can help, then I'll explain program details a little bit more. We'll talk through earliest start date, and then I'm very no pressure. It's just a way to gather information. If it sounds good to you and you're ready to heal your gut, let's do it. So I hope this was helpful. Let me know what questions, comments you have below. I will try to answer them, and we'll talk soon.